This is Navneet. I'm from Texila American University. First of all, uh, I hope you all are safe. We hope everyone is safe and healthy in this pandemic time and taking good care of yourself as well as of your family members. Basically, today's webinar is about how you can do an MBBS with free PG in USA. Because in India, you all know what is the cost of studying medicine, especially in the private colleges, if you want to go through. If we talk about studying medicine in US or American countries or American continent, or especially in India, over the past few years, apart from other studies like engineering or any other specializations, medicine has remained to be the most sought after field of study. Indian aspirants choose to study MBBS abroad for their low cost nature and the international exposure they gain due to their degree, which is incomparable. By the end of this webinar, you will come to know you will come to know the valuable insights of studying medicine in US or other part of the in and around US countries. Well, I would like to know from anyone of you if you can tell me what are the options available if you want to study medicine in US or American continent. Anyone can tell. If anyone wants to basically share some thoughts, so they can share their thoughts as well. And they can raise their hand. So if anyone wants to speak, I'll unmute them so that they can speak. Abhishek is saying voice is not clear. Abhishek, my voice is not clear. Am I audible to everyone? Hello. Now is it clear? Abhishek, Shweta. Okay, fine. Thank you so much. Might be Abhishek, there might be a network issue. Otherwise, I have checked the audio settings. It's fine. Okay, I was talking about if anyone can tell me from the participants, like anyone know what are the options in and around the for doing medical studies in MBBS, medical studies in US or any other part of the American countries. See, if you talk about the options available, obviously, first option, everyone, what comes in the mind if you talk about America is the US. So, obviously, if you have make up your mind, you can't think after 12th, after graduation. You have to start thinking right from the 10th onwards. Because studying MBBS or MD in US, what basically it is called, it is termed in US or American countries. Because it is not termed as an MBBS. MBBS is in India and MD is in US or American countries. So if you want to study MD options, if you want to study MD in US or let's say if you want to study any other PG course as well after doing your MBBS from India or any other part of the world. So there are many options, but yes, if you want to pursue this medical course right from the undergraduation side itself, so there are two options. Either you can go for the directly for the MD course in US, or else you can take a route via some other options. You can check the opportunities in and around the American side, and then you can take it further, your medical education. Anyone can tell from the participants if they know how basically you can proceed for medical education or MBBS or MD program through US. Anyone if have some information, please share. Basically, what is the eligibility criteria or what is the admission process or what are the requirements basically to pursue MBBS or medical education? Anyone from the participants, please? Okay. Uh, you can put your messages in chat box as well. If anyone wants to say something or knows anything about studying MBBS, MD, medical education in the US or in and around countries of US. Fine. No issues. I'll take it further. See, basically, if we talk about if we talk about studying medicine or MBBS undergraduate course in US, so first of all, you have to start the preparation right from your 9th or 10th standard onwards, because uh, what basically students do, those who are citizen of United States, they start from the 10th onwards, they undergo their higher secondary education, they prepare for the SAT examination, which is an aptitude test to get enrolled for the university degree, bachelor's degree, because you cannot directly enroll for MD course right after 12th, as basically it is in India. Like you all are preparing for NEET examinations, and after clearing your NEET examinations, you can directly get enrolled into the MBBS course. It's not same as in the US. If we talk about USA, you have to first of all clear the SAT examination. It's an aptitude test. So that basically you will get enrolled into the university bachelor's degree BS program, BSc program. It may be for 3 to 4 years. In the meantime, basically, you will be preparing for MCAT examinations. MCAT is basically a medical college admission test, which is being conducted for the United States medical schools. Once you clear that MCAT exam, then only you are eligible to appear, or you can take admission into the medical schools in the United States. If I talk about the Indian students, there are 2 to 3 steps basically they have to go through. First of all, you should be good in English. IELTS passing is very much required for United States medical schools. You have to clear the SAT examination as I have told. You have to get enrolled for the university's bachelor's degree. It can be for 3 to 4 years of your undergraduation with bio as a major subject. In the meantime, you will be preparing for MCAT examination. By the end of the undergraduate program, take medical college admission test. Now, what medical schools basically check your MCAT score, your undergraduate CGPA. They combine both the scores, and then you will get enrolled for the MD program in the United States medical schools. The cost is also very high. Cost is somewhere around 40 to 50,000 US dollars per year. So if you talk about in INR, it is somewhere around 2 to 3 crores only of your 4 years MD program. So you'll be starting from 12 onwards, and after 8 years, you will get your MD degree. You will be completing your MBBS course if you are planning to study in United States. Well, there are other options. As I have mentioned in the previous slide, study in the university who follow the US medical curriculum with USMLE inbuilt training. I will later tell you about what is the USMLE examination, what is USMLE, and apart from that, what are the options available to go for this. I have already cleared about the first option. Now comes the second option. What is the second option? Obviously, you have to search in and around the United States, outside the United States, because everyone cannot afford this 2 to 3 crores or obviously 8 years of education, 4 years undergraduation, again 4 years of your medical education. It's quite sometimes hectic. So there are the other options as well through which you can reduce your money, you can reduce your duration, you can reduce your time, and in the meantime, again you can go for the post-graduation medical education for the United States. At the end, our motto, our main aim is to pursue the medical education in the United States. There is another option as well, which is option 2. Study in the university which follow the United States medical curriculum. Apart from that, which guide you right from the day one, the USMLE Indian training program. They have the inbuilt training in their course itself. Texila American University. I am talking about Texila American University. Where is Texila American University? It's in Guyana. Where is Guyana? Guyana is in South American continent. It's a proper land country in the South American continent. Now, if I talk about Guyana or Texila American University, Guyana campus. Texila American University, Guyana campus was established in 2010 and is regarded as one of the top private universities in the Caribbean region. Recently, Texila American University celebrated its sixth Doctor of Medicine graduation program, which we conducted on January before this pandemic starts. We have recently completed our sixth graduation program from the campus. If we talk about the art of infrastructure, basically it has the state-of-the-art infrastructure, labs, very good laboratories, libraries with 5,000 plus books and journals. I'll brief you all these things and the campus internal things in the latest slide. The most important thing is whenever you want to study medical education outside the country, outside India, obviously you have to go through with the recognitions, affiliations, and membership card. First of all, the local country recognition affiliation is required. Obviously, Medical Council of Guyana, Texila American University is organized by the Medical Council of Guyana, a regulatory body, like same as in India, Medical Council of India. So, Medical Council of Guyana is a regulatory body formed to enhance and monitor the function of the medical fraternity in Guyana. Apart from Medical Council of Guyana, we are recognized by the National Accreditation Council of Guyana, like we have NAC in India, National Accreditation Council. The same as in India, we have the National Accreditation Council of Guyana, in which Texila American University is recognized and listed by the Department of Education. Now, third affiliation is one of the most important is any of the medical schools overall world. If it's listed in WWS, it's totally valid. You can appear your post-graduation course from, if that particular college is listed in WDMS, then you can go through with the postgraduate education in any part of the valid first-class countries like UK, US, Canada, Australia, New Zealand. Obviously, Texila American University is listed in the World Directory of Medical Sciences, which maintains the list of all medical schools in the world with accurate, and comprehensive information on each school. In that way, Texila American University students are totally eligible to write any of the post-graduation entrance examinations, whether it is in US, USMLE, whether it is in UK, PLAN, or Australian Medical Council exam, or Canadian Medical Council exam for post-graduation medical education, or New Zealand. So you can appear for any of the post-graduations. Oppo A5 is saying voice is not clear. I'm very much trying, mic is near me. I don't know what is the issue because voice is very much clear. Audio is okay. Is it fine? Oppo A5 2020. Am I properly audible? Oppo A5, other participants, please can you respond in the chat box. Okay, thank you so much. Thanks, dear. Thank you so much. So I was talking about we are studying Medical Council of Guyana, NAC, Guyana, World Directory of Medical Schools, ECFMG, Education Commission for Foreign Medical Graduates. What is ECFMG? What is basically related to TAU and especially studying medical education, post-graduation medical education in United States, that you will come to know in the later slide. Texila American University is approved on ECFMG, which evaluates the readiness of the international medical graduates to acquire residency. What is residency basically? It's basically a PG term, post-graduation. Like in India, we say it's a post-graduation, PG, MD or MS. But in United States, it is being termed as residency or fellowship program in the United States. If a person has written USMLE examination if a college is conducting the USMLE examination for its students, they need to get the ECFMG certification from the ECFMG body. Then only they can appear for the residency matching. Texila is listed there. Graduates of Texila are eligible to apply and sit for any step of the USMLE in fulfillment of the ECFMG certification requirements for US residency positions have already. At the end, yes, if you want to come back to India after 5 years of your medical undergraduate course, MD program, if you are studying in Texila, it will be for 5 years. So if you want to come back to India, obviously there is an entrance exam which is being conducted by the Medical Council of India. It's in the name of FMG, Foreign Medical Graduate Exam. For that purpose, any of the medical schools which are located abroad, or students who are going for a medical education in abroad countries, they should only go to that particular country or college which is being listed in the MCI if they want to come back to India and practice here in India. If we talk about College of Medicine, obviously Texila American University, Guyana offers Doctor of Medicine, MD program and the pre-med program. The medicine program at Texila American University, Guyana is one of the most prestigious programs that the university offers. Students from across the Caribbean region, even not only from the Caribbean region, you can, if any of you will be taking admission in the medical course MD program of Texila, they can find students across the world come to study the medicine program in Texila, because Texila is one of the renowned campus in that country, especially those who are planning to pursue their PG course, residency course, PG medical course from United States. A career in medicine presents exciting and challenging opportunities, and this is where it all begins. Texila American University has a diverse academic milieu, faculty coming up from across the world, representing a vital teaching and training component of the university. If we talk about the course of program structure of the Doctor of Medicine MD course, MBBS, either you can say MBBS in India or MD in American continents or countries. So if we talk about the MD course of Texila American University, it offers 5 years Doctor of Medicine program for the qualified candidates who already hold a, not bachelor degree, basically for those students who are in that particular country, but yes, for Indian students, it's 12th standard what basically basic criteria to get enrolled into the MD program. Program structure is divided into 3 parts. First year is totally pre-med, what you are studying in 11th and 12th, and apart from some basic medical terminologies which are being taught in first year. Preclinical, where the MD course starts, second year. Preclinical is totally a theoretical part, second and third year, MD2, MD3, whereas MD4 and MD5, clinical rotations. That is again for 2 years. So it's a total 5 years duration program. During the first year, students focus on basic science. During the second and third year, students focus on basic medical sciences under direct supervision of qualified professors, which are from across the world, across the major countries of the world. The last 2 years will focus on clinical rotations in affiliated hospitals in Guyana, US. If a person wants to take the clinical rotations in Guyana hospital, they can go through with the Guyana hospital, which is basically in the name of Georgetown Public Hospital. It's the same as we have AIMS in India, AIMS Delhi, India, one of the largest hospitals in India. In the same way, Georgetown Public Hospital is one of the biggest and the largest government-owned hospital in Guyana, Georgetown city. And there, Texila American University students do the clinical rotations. As far as US is concerned, there are listed hospitals, green listed hospitals, listed hospitals basically. We have tied up with, because we have the academic office in New York as well, which helps for all these things. So you can do your clinical rotations in United States as well. If you talk about the eligibility criteria, obviously you should have 12th pass with physics, chemistry, bio, and English with good numbers. The minimum age is 17 to 25 years. Education gap not more than 3 years. If a person has studied 12th in 2016 and if he is willing to take the admission in 2020 or 21, so obviously he has to go for a normal entrance test because there is a gap of almost 3 to 4 years. And at the end of the day, what MCI requires is NEET qualified. Labs, medical school provides every kind of resource needed by medical students to carry out their education completely. Well-equipped laboratories are there. You need a proper resources in the college where you want to study your medical education. Unless until the resources are not available in the colleges, the universities, uh, you can't go through with the proper education, proper practicals in the medical field. It offers a number of TI offers a number of facilities for student recreation. There are different departments, laboratories, labs, studying area, libraries, recreation facilities, room, where you can relax and enjoy within the campus by participating in various cultural activities. If we talk about the hostel in the Texila American University campus, it is committed to making your stay in the Guyana as comfortable as possible. The university offers a wide variety of safe and secure gender-wise hostel accommodation. The accommodation is offered on sharing or individual occupancy basis. It depends, basically, whatever you want to choose, whether you want to go with the individual occupancy, whether you want to go with the sharing occupancy. It's up to you. These are some hostel picks. Hostel rooms are designed to offer the best combination of comfort and facilities so that students can concentrate on their studies and relax. Each room is equipped with modern facilities, conveniences like fridge, telephone, Wi-Fi, internet, laundry, washing machines, etc. Canteen, we have the canteen facility in the campus. North Indian, South Indian, continental Chinese, every kind of food is available. Whatever the food you like, you can take it from the mess. Sports facility, I have already mentioned in the previous slides. Recreation facilities, recreation centers are there. Sports facilities are totally there in the campus, within the campus building itself. Because obviously a fit mind and a fit body, if you maintain that, your studies and as a person, as a personality, you will grow, and that will help you to become which will help you to basically become a successful person, not only in personal as well as in professional terms. Now, if I talk about the country Guyana, life in Guyana is a delightful experience. Guyana offers one of the finest environment and climatic conditions conducive to academic pursuits. If anyone has went to southern part of the country, coastal part of the country in India, like Andhra, Kerala, Tamil Nadu, it's the same temperature. Although in India we have much more humidity, but in Guyana the minimum temperature ranges from 20 to maximum temperature 35 degrees. So it's across the year you will find the same temperature. Winter is not there, winter season is not there. Little bit of humid because it's in the coastal regions, but yes, as far as the experience is concerned, it's one of the finest experience you will feel. Guyana boasts of being the only English-speaking country in South American continent. There are many countries. There are some around 13 countries in the South American continent, in which Guyana is the one and only English-speaking country. That will help you to understand the person. That will help you to understand the market. That will help you to understand the atmosphere. Because English is one of the most common language which we speak in India, apart from other regional languages. Now, why Texila American University? First of all, MCI approved. In the very first slide, I have mentioned it's an inbuilt training course curriculum. Right from the day one, all the students, irrespective of whether they want to go to the United States for post graduation or they come back to India after 5 years for studying PG in India. Right from the day one, we teach for both the examinations. We prepare the students for both the examinations, USMLE and FMG. USMLE for USPG, FMG for coming back to India, writing NCI examination, and then practicing in India itself. Clinical rotation and exposure, whether you want to do the clinical rotations 4th and 5th year of your MBBS or MD course in Guyana or in America itself. We have 96% FMG pass ratio rate. Basically, the student who sits for the MCI FMG examination, he clears the examination in the very first attempt itself. A USMLE, if we talk about USMLE examination, United States Medical Licensing Examination, what university assures is you will be getting a proper assurance. You will be clearing your step one examination. Basically, there are three steps. So you will be clearing your step one examination, which makes you eligible to study the fourth and fifth year of your clinical rotations part of your MD course in the United States hospital. So you have to clear your step one if you want to go through with the clinical rotations in US hospital. Obviously, after completing your course, there will be a placement assistance what university provides for a PG. Placement assistance for PG means they help, they guide, they train you for getting enrolled for the residency matching post-graduation course in United States medicine or hospitals. If I talk about why country, why do we choose Guyana in terms of or in comparison to any other nearby in and around countries or any other countries? It's a English speaking country. You don't have to study any other languages. World class education, choose from top private universities with state of the art infrastructure, pocket friendly. Everyone wants to basically, they need a good education, but somehow they can't spend more. So obviously, it's a pocket friendly, wherein you can save up to 30% of your tuition fees if we compare to Indian private colleges. Medical Council of India, study in colleges that are approved by the NCI, already mentioned. It's a feel like home. If I talk about the country, 40% of the population of that particular country are Indians, Indian descent, who went earlier, they had settled there itself. Apart from English, apart from local Guyanese language, the maximum language that is being spoken is Hindi, Bhojpuri, Bengali, Urdu, and Tamil Telugu as well. Now, we have covered the undergraduation part, MD course till now. Any queries, participants, till now? If you have any queries, please ask me so that I can time to time clear all your doubts as well. If anyone wants to have any query related to the course, related to the MBBS part, I can definitely anyone wants to say something? Anyone wants to say something? Uh, okay, I'll continue with my slides. So, till now we have gone through with this undergraduation MD program MBBS course of Texila American University. Now we will proceed with the PG part. Shweta, we have recently started from 2018 onwards. We have started the PG course as well in Texila American University. We are basically there are only currently emergency medicine is there. After completing your UG course, you can get enrolled for the PG course as well in that particular in our campus Texila itself. So we have the PG course. We have started the PG course with one specialization in emergency medicine, and later on, most likely by this year, we will be adding few more specializations. So it's a 3-year PG course in Texila for PG basically in emergency medicine, MD and SC here. Now, if I talk about basically a PG seats in US, it's not like in India. Like if I talk about the last year data, somewhere around 35,000 seats are there, and approx number of students who appeared for the PG NEET is somewhere around 80,000-90,000 students appeared for the NEET examination. It's the same as UG situation is too far from this PG seating capacity in India. UG, you all know you are not preparing for NEET examination. We have only 75-80,000 seats across India, and now the time everyone knows what are the numbers students appearing in NEET examination. It's 15,97,433 because it's daily flashing in news, so everyone knows about the numbers and accurate numbers anyone can say. It's not same as in United States. Yeah, United States PG course is totally basically termed as residency matching. NRMP National Resident Matching Program is responsible for accepting application for residency matching, that is for PG course in US, from different categories of applicants. There are two types of basically medical schools: US osteopathic medical school graduates, and apart from that, those basically apply for this PG course. So US medical school graduates, US citizen graduates who have done their medical education from other country because of the low cost and some other reasons. If they have been, like as I've told in our campus as well, many of the students are from United States because of the low cost budget and good quality education. They come here, they study 5 years MD course, 5.5 years MD program. They go back, they write their PG, and they continue with their post graduation. Because everyone cannot afford such a huge fees. Everyone cannot afford 8 years, 9 years of studies for undergraduation. So obviously they search the alternate routes. And third, those students who are non-US citizens and have done the medical graduation apart from the United States Medical School. So there are three categories, basically three categories of students who apply for this PG course in US. One is US graduate, US medical school graduate. Second one is the US graduate who has done the medical school from other country. And third is Indians or any other person who has done their medical education from any other country apart from US. This is the data. If we talk about, I have shared you all the data of Indian colleges, Indian students for PG course. If I talk about US course, number of applicants with program choices in 2018 is 37,000. Basically, students applied, and the number of seats available was 33. So it's basically almost 1:1 ratio. There is a seat for every students who are applying because they accept only that number of applications, the number of seats available in the colleges or hospitals. The number of PG year 1 positions available, 30,232. So these basically students applied and appeared for this course. So it's almost 1:1 ratio in the United States for doing PG course. This is some data which I would like to share you all. It's a 2018 residency match data. The same data I've shared in previous slide as well. But here are the percentage. 78.3 applicants matched to PG year 1 positions, and 96% positions were filled by the end of the closing of this admissions criteria. Now here you can see, if we talk about change in number matched since 2017, there was a upscale in every categories, whether it is US allopathic doctors, whether it is US osteopathic graduates, whether it is US citizens who have done from other countries. And if we compare to non-US citizen international medical graduates, it's more than the US citizen international medical graduates who have cleared this examination. The maximum filling specialization is internal medicine, family medicine, and pediatrics. These are the three major specializations basically which is being filled and which is being asked or being demanded in the United States hospitals. Now, if I talk about the residency matching, 56% non-US international medical graduates got successful match in 2018, highest in terms of number of match. You can understand what is the basically scenario in United States PG admissions. It's not at all same as in India. Here you are spending 1 crore, 2 crore, 3 crores for getting a seat of PG in any of the colleges for doing PG. But there it's not like that. You get a hefty stipend amount wherein you can manage your normal fees, you can manage your living cost, and it's totally a free of cost. That's why we say you can go and do your PG almost in a free of cost rate. if we compare to India, because you are only spending, you are only going to spend for your MBBS course. Right from the day one, focus on that. Focus, you want to go through with the USMLE examination. You want to clear that examination, and at the end, after doing your MD MBBS course, you want to get the residency matching in United States hospital to do your PG. That should be a main motto. It's, see, if you are going outside for a medical graduation, obviously you should think in that way, that you, if you want to come back to India, nothing like that, but come back to India after doing your PG, instead of coming back to India after 5 years, again fighting for less number of seats, again fighting for um, um, uh, as compared to seats, almost 2 to 3 times applicants are there. 1:4, 1:5 ratio sometimes happens in India. To go for 1:1 ratio, it will be much better. But yes, it needs a preparation. It needs your time. It needs your dedication right from the table. You have to decide basically, are you one of them? Can you grab a seat after completing your 5 years of your medical course from Texila? Can you put yourself into the residency matching in US? A resident senior earns a minimum stipend of 5 to 6 thousand per month dollar, 5 to 6 thousand per month dollar. It comes, if I talk about in a year, 60 to 70 thousand USD per year. Can you understand what is this? Basically, 6,000 US dollar means it's somewhere around almost 4 to 5 lakhs. 4 to 5 lakhs in a month you are going to earn. In this, that fees, you can easily manage your fee structure, you can easily manage your living cost, you can easily manage each and everything. That's why we say it's totally free of cost of doing PG in United States. Residency match or studying medicine in US is a dream of everyone and is not automatic progression after clinical semesters, but requires preparation from day one of your MD program. You should make up your mind. You should be dedicated. You should be fully fledged, devoted towards your study. Then only you can get through this residency matching. If you want to become a doctor, no doubt, become a doctor. But from a dream country, with a dream that yes, I'll do that residency matching, then only I'll be coming back to India. Otherwise, it's of no use. You go, you pursue your MBBS from any part of the world. After 5 years, you come back to India, you fight for NCIFMG, few years, 2, 3 years, then you feel you should do PG. Again, you fight for PG NEET. It's a quite, see, life is yours, decisions should be taken at the starting itself. You cannot think after 5 years of your MBBS education, whether where you want to go. You should start thinking right from the day one, because you are at the edge currently. You should take decisions right now. Yes, after 5 years, I will go in this way or I will go in that way. I have to do this or I want to come back to it. It's a decision that you should make up your mind right for, because you all are preparing for NEET examinations, obviously, and you should see what you mold yourself today, you will get the results after completing your studies. Here are some facts basically related to studying medicine PG in US. Now I am coming totally into the PG medicine part. In the American system, residency is the collective name for your postgraduate medicine education. It lasts from 3 to 7 years. It's not like in India, you write one entrance exam, go for 3 years of your PG, you are done as an MDMS. No. In the American system, the post graduation course duration is from 3 to 7 years. Minimum duration is 3 years, and maximum duration is 7 years. If you want to become a surgeon, neurosurgeon, orthopedic surgeon, or kind of thing, obviously you have to study more. You need to spend time more. You need to devote your life more for the post graduation education, depending upon the specialty. PG1 is basically nothing but it's a totally internship. What you are studying in your MD or MBBS course. So the first year of your post graduation in the United States is totally an internship. They brush up your graduation skills, graduation studies, graduation knowledge. Then only they basically move to U2, PG2, PG3, PG4, etc. Next years basically. Usually PG1 is a generic 1 year basic training program in a lot of specialties. PG2 is a training on one specialty. Obviously PG2 is basically PG2, PG3, PG4 are basically years. Already mentioned neurosurgery, cardiac surgeon, orthopedic surgeon, pediatric surgeon, gynec. Basically, according to your specialization, the years are being decided for the post graduation. What are the major factors influencing successful residency match? First of all, you need to clear your step 1 with a good score, which will help you to do the clinical rotations in United States Hospital of your 4th and 5th year of your undergraduation. You need a specialty specific letter of recommendation from your college where you have done your MD course. Medical student performance evaluation that dean provides the letter to the student. These are all basically, it's not the same criteria in India. In India, we write exam, we go through, we score, directly got admission. That's there are certain steps which needs to be followed. They need a letter from your college where I have done the graduation. They need the performance evaluation. How was the student in the whole 5 years? Dean provides the letter to the students. You submit those letters, recommendations to the governing body, USMLE governing body, which conducts the examinations, and then only you come eligible to write the examination. After completing step 1 and these all, you need to score good in step 2. Step 2 has 2 parts: CK, CS, clinical knowledge, clinical skills. CK is a complete theoretical part, clinical skills is a practical part. Personal statement, any failed attempt in USMLE, they obviously check. Evidence of professionalism and ethics, fluency in language spoken by your patient population. Basically, where you will be going to study your residency, what is the language maximum patients speak? So they check. First of all, factor 1, I would like to now basically get into more details of what are the factors which help you to get clear the USMLE and get admitted in PG course, residency course. Texila becomes an advantage when you go through the medical education MD course from Texila. It has inbuilt USMLE training from first year of the course. 96% USMLE step 1 pass rate. The student is writing the examination, university assures he will be clear because university allows the student to write for the USMLE examination when university itself is very much sure the student is going to clear this examination, then only we allow the student. PAU exit exam in accordance with the NBME. NBME is basically the National Board of Medical Examination, which conducts the USMLE examination. The same body conducts all the final year examinations for all the subjects. LCME is basically a License Committee on Medical Education, which has accredited the curriculum. And we have the accredited curriculum, American Standard Curriculum, in partnership with Pons Health Science University. As I mentioned, we use a US curriculum at core of academics. Second factor is specialty specific letter of recommendation. Dean's letter, medical student performance evaluation, what have you done? Your academic relationship with the faculty. Specialist ensures that students' abilities are known. Alumni of Pons Health Sciences University practices in all 50 states of United States. That's why we have done the academic partnership with that particular university. Rotations within USA ensures that students' abilities are known to the consultant directors. If you do the clinical rotations in United States hospitals, your 4th and 5th year of your medical education, graduation, MD course, MBBS course, education, it helps you to understand, it helps you to clear the practical examination in USMLE step 2, and it helps you to convince in the interview that student is able to perform in the US atmosphere, US hospitals. You know the atmosphere, you know the consultant, you know the patients, you know the disease, because you have done your clinical rotations in US hospitals. Third factor is fluency in language spoken by your patient population. what is the local population speak, which language do they speak. In that case, 50% of the total number of US students enrolled in foreign language courses take Spanish, because Spanish is one of the most spoken language in United States. Spanish is taught to all the students of Texila American University and are prepared for level 2 examination. Level 2 examination for Spanish language are conducted by few MSCs available in Guyana country itself and other Spanish speaking countries. Fourth factor is US clinical rotation. I have already cleared that. TAU's clinical assistance in New Jersey, clinical exposure in US, which is a major advantage. Guide in residency matching. We guide the students, we train the students, selection of specialization, what specialization you should select based on the historical match trends. Last year, what was the trend? Which specialization was most? In which specialization, if you go, you will be having maximum chances to get enrolled, to get the residency matching. What are the cities where you can apply, through which you can apply, which has higher matches? So obviously, these are the guidance, these are the support provided by the university through clinical assistance office in New Jersey. We use a flipped classroom model. Flipped classroom model is nothing but students can consume lecture materials according to their own pace. Teachers are present while students apply new knowledge. This is a current trending mode of teaching across world, especially in the Western countries, and we follow the same. Critical thinking, identical thinking. It's not a book knowledge, basically, what we provide. 71% of teachers who flipped their classes noticed improved grades. You can check in the Google as well, what is the basically flipped classroom. It's a kind of practical implementation, your knowledge-based implementation. Teachers give you a topic, you come up next day with all what are the available materials you can go through with, and then the discussions happen between the students. That is what we follow in the Texila American University campus. So, guys, thank you patiently for listening. Any queries, any questions, please, you can put up in chat box. Whether it is related to PG, whether it is related to UG. So admissions are going on for the Texila American University. We are recently conducting a scholarship test as well. You can enroll for the scholarship tests. We'll be conducting in the September month. There are 3 to 4 dates. If you need, we'll be sharing you the complete details in your email IDs and mobile numbers. Rest in case there is any queries, you want to ask something for the course, for the country, for the campus, so please, you are free to speak now. You can raise your hand, I'll unmute you, and we can have a discussion. Yes, please. Anyone wants to speak? Guys, come on, please speak up. If you have a discussion, we can have a normal discussion session, Q&A session, question answers. You can raise your hand and I'll unmute you so that you can speak. I have messaged this link, scholarship link. There is a link where you can register for the scholarship test so that you can avail a good percentage of scholarship in the tuition fees. Somewhere around maybe 40 to 50%, almost 40 to 50% of scholarship is available, but there are limited seats because we take these students across the world. There are limited number of seats for Indian students. There are limited number of seats from every part of the world. And yes, for those limited number of seats, we are conducting the scholarship. So you can avail as a opportunity to have your dream come true. You can basically dream of studying a medical education in the United States. See, if you go directly to US after 12th, obviously it's a hectic part. First clear IELTS, then clear SAT, then clear your, then go through with the 4 years of undergraduation. Then after clearing undergraduation, you write MCAT, then again undergo 4 years of your MD program. After that, you study for PG. So it's better go for the other options. 5 years study in Texila, complete your MD in a good way. Simultaneously, you'll be getting prepared by the university for USMLE examination for doing PG, and hereinafter you can directly get admission for the residency matching. And Guyana is basically one of the most favorite destinations, basically in last 2 3 years, especially for studying medicine. Texila is one of the most renowned campus in that particular country. We started in 2010, and now it's one of the biggest and the largest private university in that country. There are other programs as well, but yes, for any students, the major program is the medical education. MD. Yes, please, guys. Want to study? You can want to ask something related to the course or something? Please ask. Please don't hesitate. See, Shweta, PG course fees is basically not designed or not which for which PG course from United States or from Texila American University asking for. As far as Texila American University is concerned, the fees is different. If you talk about the United States PG course, obviously it's different depending upon the specialization, depending upon the city, depending upon the which part of the United States you are studying that medical education. Because fees is very nominal if you talk about a PG course in United States. Fees is not a matter. You get hefty stipend. Already I've this informed in my slides that you can earn up to 4 to 5 lakhs. In the same 4 to 5 lakhs, you can manage your fees, you can have your living cost, even you can save a good amount from that particular monthly stipend, which starts basically from 5 to 6,000 US dollars per month for the PG students. Anyone else basically who wants to speak, or we can close this webinar now. Best of luck for your NEET examination, and do well for the NEET exam. Obviously, after clearing your NEET exam, you'll be searching for good options. Again, I'm saying Texila is one of the, you can go through the website, you can call your enrollment advisors and have more inquiries and information related to the course. Thank you so much, guys. Thank you once again. Good evening to all of you. Happy weekend.